Good evening, everyone. I'll call this meeting of Health and Human Services to order. Roll call, please.
Kay Wilson,
Here.
Weed Schuman,
Here.
Marshall Savitsky, Chuck Van Etten, Dawn Pettit,
Here.
Carol Pearson, Dr. Sabrina Dunlap. You have a quorum.
Thank you. Can I have everyone stand for a pledge of allegiance, please? I pledge allegiance to the flag
United States of America.
and
To the republic for which it stands, one nation, under
indivisible,
liberty and justice for all.
Do we have certification of compliance with the open meetings law?
This meeting was noticed to the media and the public as required by Wisconsin Statute 19.84.
Thank you. Our agenda has been set. Do we have any public comments this evening? Online? All right. Moving on to approval of the minutes from our previous meeting.
I'll second that.
Motion's been made and seconded to approve the minutes from January. Any further discussion? All in favor?
Aye.
Opposed? So carried. Committee reports. LCO?
Well, I could say just something real quick regarding our new health center. It's going to be up and hopefully fully operation in April, first part of April. So that's kind of exciting for us. We've kind of repurposed both of our shelters. We now have a emergency shelter, women's and men's, in one facility, which is more or less an overnight, keep them alive through this terrible weather we're having right now until we can get them to a transition or a treatment facility. And then we have a men's sober living facility now that's operating, sponsored by a voucher system through the Department of Health. And that seems to be an up and coming program, and we're about at capacity there, but it's really helping a lot of our individuals.
Excellent.
So that's what LCO can share.
Senior Resource Center, any information there?
Nothing. They did raise quite a bit of money last month at their fundraiser on Saturday. I think $36,000. So their goal was at $50,000, I want to say, for the roof. They had a $15,000 match, so they made 15 grand. Well, someone's going to match that. So 30, 36. So that was really good. So it's a good event. Thanks for everyone who came.
Administration, acronyms. I saw a list.
You got a list.
Hallelujah.
So if there are things that are missing that I don't have on here or you'd like more clarified, just shoot that to me and I'll get those updated and added.
Excellent, thank you.
And I do have a couple of updates from admin wise. We have really kind of hit the ground running in 25. One of the goals is for increased communication amongst our leaders and those that are the leads in service programming. So one of the things, well, we're doing a couple of things to help kind of break down silos and improve communication. One is we're having a program connectedness meeting that we're meeting bi-weekly. And this, we're bringing leaders of our service lines, it's both internal and contracted services, together so that we can share what's happening in their respective areas. We're using that time to discuss about resources that we can offer and the gaps that we're seeing, and identifying barriers. And our ultimate goal is to really build connectedness, knowledge, and trust within our service lines, and breaking down silos within our agency and our contracted service providers. So working on that. Leadership meetings, we're meeting weekly, and our focus more on that is going to be on employee and internal needs, such as training, employee engagement, celebrations, and policy. We were had leadership meetings, but we would kind of cancel when people couldn't attend so much. We're just going to keep them going and making sure we are updating people along the way. Otherwise, we just lose connectedness. The other thing with Joe leaving, we are retransitioning how we're connecting there. So we have a mental health AODA program coordination meeting. And this is where we're discussing the caseloads for community support program, mobile crisis, community or comprehensive community supports, those that have commitments, and also looking at transitions. So it's kind of a utilization review, but also looking at, are there referral needs? Are there things that we can do to lower costs along the way? And what are our projections? So that has been working pretty good so far. So we'll continue to work on those. In addition, we are also working on helping the supervisors have a better handle on the budget process and where we're at monthly, and help give them more confidence in their spending and budgeting plans. Tanya has put together books for all of us, and we'll have those monthly reports. We're going to meet with each supervisor, Carrie, me and Tanya will be meeting monthly to help make sure that we're on target. The other thing is we may help us early on pinpoint some issues and or identify areas that we can find cost savings. So a little bit more informed approach as we move forward. So I'm hoping the budgeting process goes much smoother this year. Last year was our big transition with Patty leaving and then kind of taking it on and working with Mike. And so I think we should be in a pretty good place this year as we go forward as being informed. I think except for staffing, the other things we'll kind of talk about as we get to those areas. Staffing, we have 3 positions posted: a youth diversion and truancy specialist, admin assistants, 2 of those, and a mental health counselor. So actually there's 4 positions. We've done interviews for the youth diversion and truancy specialist, so we hope to be coming to a conclusion on that. We'll be interviewing on the admin assistants and mental health counselor. Let's start pushing that out there. If you know anybody who might be interested, send them our way. We would love to interview them. That's my admin report. I don't know if Andy has anything additional.
The only thing I emailed out earlier, just a few minutes ago, WCA's legislative platform does include requests to the legislature for funding for crisis and community support programs. So just shared that with you to see what we're talking to the legislature about.
Okay. Adult long-term care report.
Okay, Carol included both November and December as we missed the November report on the last one. A couple things I want to just highlight on her report would be that the adult long-term care unit has been having some presentations that they're providing to help people be more aware of what the ADRC and APS does and how to connect with them better. And so they did this for North Lakes Community Clinic, their community workers, and worked with and they're working with Northland counseling staff as well. Sometimes there's barriers as to how do we transition people, especially when they have mental health services, and then as they get older and may need to be moving more into long-term care needs. And so that can get a little difficult as we move forward. The other thing is our EBS, our elder benefit specialist, was at the LCO Medicare event panel that took place on November 8th, and that went really well. So glad to be a part of that. And when it comes to adult protective services, we do have the full year where we have 65 open cases for APS. And to highlight the areas, there were 31 cases of financial exploitation, which amounted to $2.1+ million being exploited from our elders. The other thing that we're doing from APS is also supporting LCO Elder Center as they are transitioning and hiring an APS specialist. So those are some of the key things I wanted to call out there. Does anybody have any questions or comments on any of the rest of the report?
I guess what are they doing? What are you doing for the LCO Elder Center then? Providing support?
They're the APS specialists, they're in between APS specialists, so we are providing that APS support, working directly with them, making sure that services can be rendered while we're in between.
Thank you.
Kind of like we would do with CPS and Indian Child Welfare.
Behavioral health.
Okay, we have a number of reports. Alicia, did you want to call anything out? Okay, so I have a couple things I'll call out just on the report. One of the things that we're working on is the crisis intervention partners training. Alicia did a nice job explaining what that is in here. It is a 16-hour course that is modeled after the crisis intervention team program, which is a 40-hour course that's meant more for law enforcement. And what we are working with is helping people better understand and work with people who are experiencing mental health crises. So it is something that we do through NAMI. The long-term goal of that is that we will actually become the trainers for the county in the future. So they're going to come in, they do this at no cost for us. They'll train us in, provide training for 40 people at no cost. And then we'll also learn how to do the training in the future and be able to have more people trained on this. And it should really help with trauma-informed approaches, help with de-escalation, and just having better communication with people who are dealing with mental health. You have
Yeah,
questions?
Julie, how many consumers are enrolled in our CCS program? Because I was reading that note, it says, we recently discharged our last.
Yeah, and with Joe leaving and that transition into there, we are down on our CCS program. Building that up with our new mental health clinician as we get there is what we're looking at. At this time, though, Ms. Sands is transitioning because we have such a need in the CLTS area. We're overloaded in that area, so we've pulled her to help support that while we build up the CCS programming.
Because isn't CCS a revenue generator though? I mean,
It's
you
not
can bill.
You can bill for it. It's not revenue generating. It's
remember
just
when you
cost
put-
neutral. Yeah,
Cost neutral.
yes.
No matter how many consumers.
It, depending on how the program, what all you've got going on. So what happens is, and this is where we talked about with, can do direct billing with CCS. Should we not, but usually that direct billing doesn't cover your expenses. Medicaid doesn't cover the expenses. And that's where that WMCR, and I cannot remember what the acronym is, and that's probably one I should put in there, that's where we get our costs on the back end the following year. We have to turn in reports that show how much staff time was put to X, Y, and Z, how much our expenses were, and then they make us whole on the back end.
Like
So,
that FQHC, we used to call that.
is that?
Money that comes in after you.
After, yep. So the same thing, that's the same programming that we're wanting to do. CSP has some that comes back, and so does Crisis through that WMCR process, but it's not fully funded to make us whole, and that's the request that we're asking for there. So we'll be looking at, what are we looking at with our CSP population as we move forward? Are there opportunities to transition to CCS, and really establishing what our provider network would look like for CCS too? So those are the areas that we want to really focus in on.
So we don't have staff then where there's no clients.
No, no,
They must be
because she's
cross-trained to do it
actually,
as something
she's
else?
cross-trained into another thing rather than hiring somebody in for the CLTS position. We've transitioned her into that, so we don't have somebody that's just sitting there not busy. So
Okay.
making really good use of transitioning, and really happy with the outcomes and what we're seeing with Ms. Sands. She's really taken on the CLTS program grasp it really quickly. She also has taken on the intoxicated driver program. That was something that Joe used to see all those clients and do the assessments on, and now she's doing those. So making good use of our staff. So those were the things. The other thing I wanted to call out on this is that Coordinator Carlson, who works in the CST program, is going to be working with the Hayward school districts on their after-school program. So that will help really draw in and find those kids that may be in need of those services. And then also, we're working hard on the care team meetings, and so that's the other piece where we're drawing it. We had some availability of some staff time, but we had some staff needs within our department, and Alicia's team's been able to help fill those gaps for us rather than either going without or needing to hire. So that's on the behavioral health report, but I know there's a couple other topics on here. If there's any other questions. Okay, then I'm going to move on to just the mental health crisis and transitions update. That's where I told you that we were having those coordinated meetings, really trying to get an idea of what's happening with crisis and making sure we keep tabs on transitions. Joe was the director of transitions. Now I am taking over kind of that role with transitions as we move forward. So update with mental health crisis. We are updating our forms that we use with the hospital. Northland Counseling is actually contracted with the hospital to do the all voluntary screening for mental health crisis in there at the hospital. And then we contract for them to do the involuntary screening. It's worked out really well for the transition. She started doing that, I believe, sometime in May for the hospital. And it works out great because what we've been seeing is that before Northland Counseling took that on, they used to contract, and I can't remember who it was, but with a telehealth provider. And sometimes they wouldn't get on for a screening for 7-8 hours. By that time, that person is done being in the ED and they want to leave. And then the physicians are saying, no, you can't leave because we need to get this screening. We don't trust that you're safe to go home. And then that would turn into an involuntary placement on our end of things. Because Northland Counseling has been able to get in there right away and be able to assess the situation. It has really made a difference in our involuntary placements on our end. So that will be a cost savings for us over time. So that has been great. And then the other thing to report on, and I don't even want to say this out loud, but January was an extremely slow month, both on the hospital side on behavioral health and on for anything involuntary on our end. So I know I should not say that loud. We don't quite understand the dynamic, and it hasn't really picked up yet, but we'll keep watching to see what's happening.
It's a full moon tomorrow.
Okay, thank you. They're really gonna, I did not use the Q word, but it's been, so wanted to let you know
Julie, I got a
that.
question.
Yes.
So are you gonna take over then the diversion that Mr. Bodo used to do at the crisis situation, whether they were
So Northland.
Mendota or Winnebago?
Yeah, so Northland Counseling will make the initial decisions on that. So we have set places that they're able to say, okay, yes, they do need an emergency placement. And Northland Counseling so if law enforcement needs to call, they're calling Northland Counseling rather than calling Mr. Bodo
24/7?
24/7.
Wow.
And so that's happening.
No way.
Then if they need me, and at this time, Joe would pick up a phone too, if there's any questions, like, I don't really know what to do with this. But they can also call me if they have questions on, is this a appropriate placement or not as we move forward, because we want to make sure that we're not placing people in an involuntary placement when they shouldn't be placed there. So that's really one of the crux of it. And I think the main hindrance of this is that from a hospital perspective, when we say they're medically cleared, hospitals and physicians just think of that as, yep, they're healthy enough to go. But when we think of it as medically cleared on our end, we also need them to be sober enough. They cannot be under the influence of drugs and alcohol. And so sometimes they have to sit there 12 hours before we can have a full screening assessment, because they might not be suicidal really. It might just be the drugs and alcohol. And once that comes down out of their system, we're able to do safety planning and get them home. We do want to prevent placements as much as possible. So those are the things that we've been working on. I'm diving in and learning a lot more than I ever anticipated. And Joe has been very helpful on the back end of things and really helping to, even tonight, kind of walking through some of the commitments and the things that I need to have in place. So I value the fact that he's been available to help teach me along the way.
So with Northland Counseling taking over some of the answering the calls and things, is that going to affect our budget at all?
No, because actually Northland Counseling was so Joe would do the initial screening and then he would call Northland to say, yes, you do need, go to the hospital, law enforcement's going to meet you there and you need to do a screening. So they were always on
They were there
anyways.
anyway.
And so now we're taking that away, and really kind of watching things more on the back end versus the front end of things. So utilization review will be important along the way.
I have one question. My understanding was there are very few facilities left for placement. So how is that going with the situation?
It's difficult. Sometimes we, even for a voluntary placement, to give an example, I think it was back in December, I'm looking, I don't think anybody was involved in that case, ended up having to place all the way down at Rogers in Milwaukee. And then to try to get people back up here once they're done with that short-term commitment, that's really, we're looking at transport and issues with that. So,
Big cost involved also with the transportation.
also with the transportation. However, did I put transportation on?
I believe you did somewhere. I saw it.
Anyways, we can talk a little bit about that because we're talking about crisis and transportation goes hand in hand. So we have been using Assurance, which is the new, and we talked about this. I actually might not have put it back on because we talked about this last month, but have had pretty good luck with them being able to be available and make those pickups or drop-offs very easily for us. And really what we've been kind of needing to use it for is things outside of where law enforcement would have been involved. So sometimes we have to transfer youth or do different things that are outside of that main system. And so, and they're able to do that transport without having them in restraints, which is important for us.
I have one more question, Julie. When the the physician thinks that the person is medically okay to leave, but yet we know because of the influence of whatever, they're willing to keep that individual until
We're
Northland
ready.
releases them?
Yeah, so
Okay.
what we were doing is we noticed that our forms were probably not clear enough. So Caitlin has updated our forms so that we're actually literally asking for lab reports so we understand if they're under the influence of anything.
Thank you.
So should I move to the mental health expense report and cost by client report?
Certainly.
Okay, so on the expense report of note, because this now gets us in through the year, there were our projected annual expenses. We were under our projected annual expenses, and Tanya put together this note for me, so this is very helpful. With Helping Hands, where we did go over Helping Hands, there were unplanned medical expenses during the year. With Limitless, we didn't include the leap year in our projections, so that caused us to go over. At New Beginnings, there was a client who lost their placement and then needed to go there. And then for Winnebago, the annual projection was based on the average of the prior 2 years. And we had almost 100,000 more in revenue than we did in 2023. And we had about half the expenses that we did in 2023. So that's why Winnebago ended up looking the way it did. And then for the clients, nothing new on there. We have started having discussions on how we can potentially get a couple of clients, hopefully to a less restrictive means, but I'm not expecting it to happen anytime soon, but we are working with the caretakers on a couple of them. Okay, that was a lot for your behavioral health report area. Any further questions? I don't
Yeah,
always
these,
do that.
Julie, these clients, then they're at either Mendota or Winnebago? Is that what you're saying?
No, these clients that are these long-term clients,
Yeah.
the A through D, these are placed in facilities like Limitless
Red line.
and Helping Hands, and we have I think in Trumpelow, I can't remember what that's called. With this New Beginnings, Helping Hands, and there's one other. So they're in long-term placements, not like a Winnebago short-term placement.
Oh, I see. And Medicaid covers these costs?
No,
No.
no, these are commitments under us,
'Cause They
so
all say they have Medicaid.
we have some Medicaid. Oh, it does not cover yes, there's Medicaid, they have Medicaid, but it does not cover their costs completely.
Oh, I see.
Yes.
Gotcha. A portion of the cost.
Portions of the cost,
Yes.
yes. Okay, anything else? Okay, moving on to then Child Protective Services and Youth Justice, and I think Sarah is on.
Yes, she is.
Okay. Sarah, did you want to give an update? If we can get her. Oh, there she goes.
Sorry. The update that I would have is to touch base on our new grant funded programs. So we're running a bit behind on, we anticipated starting our new diversion program working with Truancy in January. It did interviews Monday of this week. We are making an offer to someone to be able to start. I'm hopeful that he'll be able to start within the next 2 weeks. It also is, social work is often a female-dominated kind of area of expertise, and I'm really excited that we have a male joining our team. And why I'm excited about this is because a lot of our young men that we have on our youth justice caseloads is, they're lacking that strong, positive male role model in their life. And I'm excited for them to, have someone that will be that for them. So yeah, we are starting to get that going. And then we also have been the program that I talked about, Sorona, where we were contracting with them for the other grants that we received. I believe there were offers made to individuals to also get that program up and running. And just a reminder, that program was designed so that it's kind of an arm of youth justice and the diversion program, where we will have people more in homes working with families on positive communication, empowering parents to take their role back as parents, because I think a lot of times we see that the youth that we're working with have more power in the home than the parents and have more say in the home. So we also want to work with them on being able to implement consequences as well as rewards. Through that contract with that program, we are also hoping to hire a part-time therapist, so that we also have that dynamic within the home as well. And we're really excited about these new opportunities for our Sawyer County families and being able to get in there a little bit sooner to prevent some of the youth justice referrals where we have delinquent youth. We want to get in there sooner to start to lower those numbers. Any questions on that?
Does anybody have any questions on the CPS out-of-home placement report, youth justice report, or the children in care report? Those are the standard reports that she's always included. The other thing, Sarah, before you mute your mic, I think we want to be able to call out Erica Prince.
Yes.
And if you want to explain what permanency means so that everybody understands what this means.
Yes, I did forget that we put this slide in there, but this is definitely a celebration on our end. Erica Prince has worked very hard on establishing permanency for the kids that have been removed from their parents' home. So what permanency means is, and it might be questionable if you don't truly understand it as to why we're celebrating basically a parent's rights having been terminated. But what that does for these kids is we are required by Wisconsin state statute that if parents aren't making good progress toward their court-ordered conditions to get their kids back by the time 15 to 22 months comes, we will then file a petition to terminate parental rights. And that is to get these kids that have been removed from their home a sense of permanency. So that may be a foster parent adopting them or taking guardianship, or a family member taking guardianship. And these kids no longer have to question if they're going back home, what their future holds. It gives them that sense of permanency. So that being said, Erica has, I would say within the last year, she has given 10 kids permanency, which is really worth celebrating. Some of this was a kind of cleanup from what hadn't been done over the past several years. But all in all, it was a lot of work and perseverance, and takes a lot of dedication to do what she did. So I just want to recognize her.
Probably a lot of paperwork.
A lot,
Yes, a lot of work.
Court hearings, notifications, lots of different
Just
things.
think of the stress that was removed from these 10 children.
Right, yep. Yes.
Excellent.
I have just a couple more updates with the CPS and youth justice area. One of the things that we'll be bringing to the table, and I will add this to the meeting next month so that people can read us, but there is the 1983 Wisconsin Act 161. And Act 161 is a mechanism where county departments and of social work and makes the payments for the out-of-home placements for Indian children when the placement is ordered by the tribal court or the county. And so we are to have a written agreement that outlines this and other details. And I won't go through that right now, but I want to just kind of set you guys up for this is coming through. We had worked on this agreement last year. We have an agreement that just continues on, but it needs to be updated. So we've worked on that. I've gotten information from Sarah for updates on it, and have met with Tibissum, and we'll be bringing that forward to Corp Counsel and the Attorney General for LCO. And then from there, it comes to this committee. So just want to kind of just highlight that work that will be coming forth and giving you an understanding of what that means. So next month, I'll include the act itself, which is only 2 pages, but it gives you an idea of what to be expecting in there. And then when you get it, then you'll better understand what's there. The nice thing about what we have in our 161 is it isn't just about financials, it's about how we work together. And as we look through that, we've identified areas that just needed clarification a little bit more to help improve how we work together. So we will be adding that. The other thing is that we will also, we met with law enforcement and had training with CPS and law enforcement. I think I talked about that last month. What we've identified is through our forensic interviewing, we lost our child advocacy center. We didn't have anybody to do forensic interviewing. Sarah has just completed the course and actually did a forensic interview today for law enforcement. So that's been awesome. And we also have a law enforcement officer who also went through the training, but he's not quite through. He has to do one more. And then we also have Julie Loader, who has gone through the training, who works for ICW. So what we'll need to be doing is starting a multidisciplinary team. Takes a lot of work to get that started, but you need to work together as a team to identify these cases and work through them and also get learnings through them. So have to identify how we're going to do that. We've always had somebody external to be able to do that. And then also drug endangered children program. We used to have that as a county. That's gone away. As I look at it, it probably went away when the meth houses kind of stopped and they became, started just doing meth by the one pot rather than having the big labs in the home. But it is definitely something that we need to bring back. So we'll be looking at that as well. So I think we have one meeting scheduled already in February to start talking about MDT and working together with law enforcement and ICW. So that's a lot going on in that area.
Julia, have you and Tabissum and Sarah met now to kind of resolve any?
Tabissum and I just met today. I just got back because
Okay.
I left, right? And so
Yeah.
I just got back. Tabissum and I have left. Actually, Tabissum and Sarah and the team met today and have been and we're working on some things today. I just wasn't involved in that meeting.
Good. Okay.
So,
Because I know that's come up.
yep. Okay. I know I'm talking a lot, you guys. Sorry. There's a lot going on.
Perfect.
Okay, economic support. And I don't know if Shauna probably has basketball tonight. I'm guessing she's not on. Okay, so I don't, as far as I know, there isn't any outs or anything that's needs to be shared outside of the report in economic support update. I also included the Northwest Connection quarterly report. We, as a reminder, we received money through the state for childcare certification. We actually contract those services through Northwest Connections, and this is the quarterly report they've given us. The one thing that I would like to highlight is that we are very low on childcare providers. And their outreach for the last quarter did not have anybody coming in with any interest of starting or looking at any licensing as you go through that report. So we're going to try to work on gaining more childcare providers in the area and be connecting with them a bit more on how we can help support them.
How many are you down?
There's only 3, and I don't have the record of how many we've dropped down. But if that's a good question, and if I can get that pulled, I will. It's maybe more of how many do we need. The other thing, though, that Northwest Connection is doing when it comes to childcare is rather than if somebody calls to look for childcare resources, rather than giving them 5 places to call, Northwest Connections now is actually making those calls to those childcare providers to get children placed. And that's been really helping place kids that might not have been placed in childcare. So that's great for our workforce. Most of the time, people who need childcare are finding jobs and getting into employment, which we need. Okay. Public health. Guessing Julie's got some updates.
Yeah, I did want to just mention that as of Friday, we were still seeing increases in our respiratory illnesses, both locally, regionally, and statewide. Those numbers haven't peaked yet. We're still on the incline on that. A number of Sawyer County residents were hospitalized for respiratory illness in the month of January, so we were seeing increases in that regard as well. At the end of January, we had a tabletop exercise. 14 agencies and 41 individuals participated. We had some really good takeaways from that exercise and really grateful to all those who participated. And the last thing, it's not on my written report, but I do want to highlight, Sawyer County is a part of the Wisconsin Association of Local Public Health Departments and Boards, as well as we're a part of the National Associations of Local Boards of Health. These agencies are there for resources for boards of health and for local health departments both. And I will be updating our profile on Sawyer County with your public-facing contact information. So if you hear or get an email regarding that, it's because we are a part of those organizations to support you as a local Board of Health member. Any questions? Thank you.
Thank you. Fiscal budget performance report.
Yeah, this is not the final report. Those projections were just, I think just ran. Did Tanya just finish those? So next month we'll have the final with where we drew everything over and how that all looks. There were some finals coming through. Despite the fact that we had such the expenses in the youth placements, we've had cost savings in other areas. So we shouldn't be too far off. Met with Mike, I want to say 2-3 weeks ago, really to look at that, and no major concerns came from Mike as we move forward with that, but we'll get that final as we move forward. A little early in the year to identify where we're at, but as we just heard, at least for the mental health crisis, been slow on that area. So no surprises coming at us.
We
And
do have
nothing
a
major. Mhm.
reserve fund though, right? That we can
Yes,
dip into.
yes.
We need, what do they call that, Andy? Okay,
Mhm.
because I know in the past we've had to dip into that with out of
I'm
county
hoping we're
placements.
budgeting, or we're hoping to be budgeting much better. You know, remember we used to not, good grammar, used to not plan or for those projections and not really get that budgeted. Yeah, Carol's laughing. It's like, yeah,
We couldn't balance the budget. We couldn't.
Yeah. So it's nice, the way we're doing the budget now, because it's much more realistic, even with the staff increases and everything. So I feel much more comfortable with the budgets as we move forward. Okay. Oh, and budget recap. Yeah, there's just not much in there that's really standing out. And like I said, next month will be the final, so we'll know exactly where that's at. Do we want to move to?
The revenue, the purchase service recap,
Yeah, there's
nothing.
nothing to call out.
And the revenue recap report,
Mhm.
or anything there?
I think I already called out kind of where we saw the things on the mental health cost report.
Okay.
That tends to be some of our biggest areas.
Do you have
Andy,
anything else that
I'm
you
sorry.
would like to share? Julia?
I just got back from a peer conference for criminal justice coordinating committees or councils in Denver. I went with Judge Smith from LCO. We learned a lot, got some good contacts, and I know it's not direct to this, but influential with mental health and different things. we're definitely not alone in what we see in our jails and what's happening around here, but some new ideas on how people are working with things. And there was lots of discussion on what's going to happen with funding and where things go with that. But as we've all seen it, we don't really know. So we've got to just keep going as business as normal. We don't have any funds out there that make me real nervous. As far as like the cuts for things that are specific to diversity or specific to different things that have been called out. We don't have any funds that are too targeted in those areas that I'm overly concerned with. And we're just going to have to wait and see on other funding how that all works.
You're not concerned about the vaccines they're looking at and whether they're worthwhile or continuing?
Well, but that's not necessarily a funding question.
Right.
So when I talk through that, we'll face things when we need to face them. But at this point, there's so much
unknown.
energy to spend on so many things that we know are concrete that the speculation at this point, I'm trying to work with the areas that I know is what we need to be focused on and where we can make a difference.
Do we have any information on correspondence from conferences and meetings other than what Julie just did? Anybody else? Future agenda items? You just had.
Oh, the 161 I'm going to add.
161.
Yep, I'm going to add 161.
Anything else anybody wants to see a report on? All right. Let's call it a night. We're adjourned. Thank
Okay,
you very
thank
much,
you.
everyone.